Okay. Got it tweeted out. And we are ready to move into our next section of the conversation. So, last hour I talked about the phenomenon of job lock, which is where people get locked down into their jobs in the United States because they fear losing their health insurance, or they can't afford health insurance outside of their employer. This is something that means that people cannot move to different jobs, cannot take risks to find better jobs. It's something that stifles the innovation of America, that prevents people from pursuing the things that they want to pursue in their life, and generally, I would argue, negatively impacts every single American. Not even every single American, every single person in America, regardless of their nationality, regardless of their citizenship. Now we're going to be moving to talk about something that I talked about a little while ago on stream, mainly disability and how it relates to healthcare. So one of the things that is really quite invisible, especially to people who aren't on disability, right, is the fact that a lot of people on disability are just permanently trapped in poverty, right? One of the ways this happens is that essentially by being poor and on disability, you are given you live under a means-tested society. So this means testing for disabled folks essentially puts limits on how much stuff disabled people can own. Now, I believe before, when I talked about this on stream, there were a few inaccuracies to my communication. I just want to clarify a few things. So here, we're gonna look at these these limits, okay? Real quick. What actually limits people on disability? Because it's actually pretty awful, pretty wild. And guess what? We shouldn't have to means test people's disability status. We shouldn't means test them for their eligibility to receive health care. I've always wanted a segue. Segues are pretty cool, Mossy Stone. Also, congratulations for your first chat. So when I say we means test the disabled, what does this mean? Okay, let's take a look. In Illinois, you can't have more than $2,000 in the bank, and you need to reapply every 3 years. Yeah, so we're going to learn about this a little bit. All right. So how much can I have in assets and still be eligible for disability benefits? SSI limits how much you can have in assets, aka property, and be eligible for disability benefits, but many assets don't count. So what does count and what doesn't? So SSI stands for Supplemental Security Income, a need-based program for people with low income and low assets. Unlike SSI, Social Security Disability Insurance, or SSDI, is a benefit that people qualify for as a result of contributions paid into the Social Security system. SSDI doesn't have limits. However, a lot of people who are on SSDI also need SSI. So, let's take a look at this. To be eligible to receive SSI benefits based on disability, an SSI applicant or a current SSI recipient who is single cannot have more than $2,000 in assets. If an SSI applicant or recipient is married, even if only one person is eligible for disability, the asset limit is $3,000. So, if you get married, your asset limit goes up by $1,000, but also frequently when you get married, your assets are combined, meaning that your partner, especially if they are not disabled, and even if they are disabled, likely has somewhere over half of their assets that they're allowed to have. So by getting married, you essentially lose SSI almost immediately. Only the IRA or pension plan of the ineligible spouse isn't treated as part of the spouse's assets. Similarly, if a child under age 18 lives with one parent, the SSA deems the resources of a parent or parent's spouse. So what counts towards the SSI limit? So the SSA defines these as counting towards the SSI limit. Cash, money in a checking or savings account. Cash value of life insurance policies, over $1,500. Stocks and bonds, household goods, and personal effects, over $2,000. Motor vehicles, except for one. And real estate, other than the home in which a claimant resides. So essentially, if you're on SSI, which again, most people on disability are, you can't have more than $2,000 in cash in your bank account. If you do, you're gonna lose your ability to keep getting money. You also can't have that money in stocks or bonds. And you also can't have that money in, like, personal stuff. So if you have a computer that is worth, like, $1,500 because of the parts in it, it's likely that you are going to be losing your SSI because of the other stuff you have on top of that. Now, there are things that are exempt. For example, you can own a car, and that doesn't count up towards the limit. Let's see. And also your home. So whatever home you live in is also exempt from the limit. Wedding rings are also exempt, as are ABLE accounts, which are essentially accounts that disabled folks are able to have that store up to $100,000 that for disabled people before the age of 26. Which, yeah, a lot of people aren't going to have that. They aren't going to have $100K in an ABLE account. Yeah, they don't take your gold rings. That's good. You also burial funds aren't don't count against that either. So yeah. And then support payments. Support payments can be held up for up to 9 months before they can count towards your resource limit. So basically state, local relocation assistance payments, crime victims assistance, earned income tax credit payments, grants, scholarships, etc., and child tax credit payments. So yeah, basically you're kind of fucked if you are on disability. And you need the SSI. If you don't happen to be in, like, a wealthy family that can take care of you, or if you don't happen to be able to like perform highly skilled labor that you are compensated for, you need to rely on SSI and your SSDI, you're going to be in a lot of trouble. You're going to be in a lot of trouble. And now I do want to remind you all again, cars and the car you own for transportation and the real estate you own for living in do not count towards this. So you could theoretically own a home on this, but also how are you going to own a home if you can't have over $3,000 in your savings account or your checking account? Like, I'm sorry, you aren't going to be able to qualify for a home. Low income housing, yeah, you can rent, but, like, unless you're inheriting that home from somebody, like, I don't think you're gonna be able to buy a house anywhere. But yeah, motor vehicle, sure, maybe you can get one of those. Yeah, so this is pretty awful. Basically, SSI claimants who exceed the $2,000 limit, or $3K if married, are ineligible for benefits. And in fact, claimants who are over the resource limit will not even have their disability claim fully evaluated to see if they are medically eligible for disability benefits. So you just like immediately get cut off. Oh, yeah, Real Dan Cody. For most people in the United States, in my generation and younger, we're like almost none of us are going to be able to own homes. I've gone through the ringer with the Social Security Administration. I had a health condition that I thought qualified, and it didn't, and the payouts were coming. They flipped around and put me $7,000 in debt. Oh my God, Philosopher, I'm really sorry to hear that. So when we're talking about qualifying for SSI, right, and the means testing that goes into SSI, why do we accept this as a society? Why not just have Medicare for all and not have this arbitrary limit on what you can receive based on your disability status? So let's take a look at an article from American Progress that I found very interesting. This is from last year, titled "A Deadly Poverty Trap: Asset Limits and in the Time of Coronavirus." As the COVID-19 pandemic triggers unprecedented economic turmoil, lawmakers, economists, and advocates are renewing calls to eliminate asset tests in public assistance programs. These tests, which require applicants and beneficiaries to have resources below a certain threshold in order to qualify for benefits, trap people in a state of economic precarity and have been particularly harmful for people with disabilities whose economic condition has generally declined since the 1970s. They almost always deny your application, and you need to find a Social Security lawyer to get your pathetic pittance. That is very depressing. Years of research show that asset limits are an impediment to saving and wealth building, but most major public assistance programs continue to rely on them to determine eligibility. Alarmingly, this means that people who've participated in benefits programs lack the savings necessary to weather the financial storm triggered by COVID-19. This pandemic may increase legislative will, at least temporarily, to suspend asset tests for certain programs and raise the asset limits for supplemental security income recipients. However, it should not have taken a global pandemic to recognize that a system that bars low-income, mostly disabled beneficiaries from saving would render them more acutely vulnerable during crises. And so this is one of the things, right? This is one of the issues. When we means test income assistance, right? We are also means testing healthcare ability in this country, the ability to get healthcare. So when we're saying, oh, you're not disabled enough for SSI and SSDI, turns out you lose your health care. You lose your ability to also get health care in the private system because you don't have the money to get it. So it kind of is this that you get fucked from both sides. You get spit roasted by the system if you're disabled in America. Oh, it gets way worse? Absolutely. Most public assistance programs are means tested in that they restrict eligibility to people with incomes below a certain threshold and apply stringent asset tests to ensure that beneficiaries' resources do not exceed the limit set for that program. With unemployment spiking because of the coronavirus pandemic, these asset restrictions will prevent many newly unemployed people from obtaining the relief these benefits programs provide. Remember, in the previous segment we did, there was a woman who talked about her experiences being rendered ineligible for health insurance because she made too much money to qualify for Medicaid. She made too much money because of the additional economic assistance put forward by the government to help people through the coronavirus pandemic. Yeah, exactly, Meat Bomb. And that's the other issue, is that healthcare is intrinsically tied with the rest of our system. Healthcare is tied to the economic conditions people are in. If you have more money, you are able to, for example, buy better food. You are able to afford time off. You are able to take mental health days. This is something that people who are forced to live in permanently precarious situations cannot afford to do. And when you can't afford to do that, you suffer health costs. There are tangible physical tolls on your body for the stress, for the shame, for the decisions you are forced into making because of your income level. So let's keep looking at this stuff. These limits are purportedly in place to ensure that only the neediest people receive benefits. In practice, however, they set up a perverse and counterintuitive incentive structure that compels people to spend down their monthly earnings or risk having their benefits cut. Put simply, benefits recipients are forced to compromise their long-term economic security by depleting their existing savings in order to attain the immediate and life-sustaining relief these benefit programs provide. Furthermore, the variability across programs creates a bureaucratic quagmire that serves as a barrier to applying for and receiving needed assistance. This is by design. It is purposely designed to be a bureaucratic nightmare for people to navigate, to prevent them from getting all of the benefits they qualify for. That is a deliberate move by people in power to spend less money on public assistance programs. Let's see here. Financial exclusion. In 2017, slightly more than one quarter, 26% of working-age people with disabilities lived in poverty, more than twice the rate of their non-disabled peers. Furthermore, a whopping 60.5% of households containing a person with a disability were considered asset poor, meaning they did not have enough resources to live at the federal poverty level for 3 months. In 2020, a family of 4 would need at least $6,550 to live at the federal poverty line for 3 months. Yet this amount is higher than the asset limit set for the Supplemental Nutrition Assistance Program, SNAP, and temporary assistance for needy families, TANF, in several states. There is evidence to show that people who receive means-tested public assistance are more likely to be asset poor than low-income people who are not enrolled. In fact, asset tests in public assistance programs are associated with a diminished likelihood of benefits recipients having even modest savings, as well as a greater likelihood of them being unbanked or underbanked, having a bank account but also using alternative financial services such as payday loans. So basically, again, this is confirming something that we have known for a long time. Being poor is more expensive than being rich. You take on all kinds of different costs by being poor. And we don't need to means test health insurance. This is one of the things. We don't need to means test people who are poor just so that they can go to the hospital. It traps the poor in this horrific cycle of poverty that they cannot escape from. And this isn't, by the way, just about means testing healthcare. It's also about means testing other things. By means testing all of these systems, we are essentially causing the suffering of people who are living in poverty for no reason other than the fact that people like the idea of means testing because it intuitively seems to make sense on a certain level. But it doesn't, in practice, actually work that way. The U.S. criminal legal system has grown increasingly entangled with the administration of public assistance programs. Following the welfare reform policies of the 1990s, states began collecting more invasive biometric data and information from applicants, beneficiaries, and their families. These data are often shared with law enforcement, expanding the reach of the carceral system and forcing applicants and beneficiaries to forgo most expectations of privacy in order to retain eligibility. Critically, law enforcement is not simply engaged in passive surveillance, but rather actively using it as a tool to punish people who have evaded the reach of the criminal legal system. For example, people who have outstanding warrants or have violated the terms of their parole risk having their benefits cut. Additionally, the latest COVID-19 response package bars people who have fallen behind on child support payments from receiving the $1,200 stimulus check. In 2019, the Trump administration proposed monitoring the social media use of recipients of Social Security benefits in order to identify fraud. While this proposal was ultimately dropped, it reflects a disturbing reality for benefits recipients. Even though fraud is incredibly rare, presumptive criminality is attached to those who apply for and depend on benefits. This web of criminalization and surveillance ensnares people with disabilities who are overrepresented in the carceral system and more likely to have criminal records or receive a mental illness adjudication, further undermining their economic security. So, this is a system that has been designed that by means testing these things, we have the stigma of criminality attached to people simply trying to live and having no other way to survive in our capitalist society. It is incredibly messed up, and one of the primary driving factors of people living in poverty is healthcare. Healthcare puts people into precarious situations. Healthcare drains bank accounts and drives people into bankruptcy and then into poverty. Having these systems in place literally reinforces the current system of poverty. It reinforces, strengthens, and ultimately contributes to the cycle of growing poverty in the United States. And like, this isn't just this isn't just about people living below the poverty line or in the working class. This affects people in the middle class too. If you're in the middle class and you think you are doing totally fine, all it takes is one strange lump and a trip to the doctor, and all of a sudden you are going to be like our previous guest talked about, like Laura Packard talked about on the show. All of a sudden, unexpectedly, a $100,000 bill. You're fucked. You're just fucked economically. And if you aren't ready, if you aren't in an immensely privileged situation, that $100,000 bill is going to completely sink you out of the middle class, into the working class if you're lucky, and into poverty if you're not lucky. Like, it's a system designed to funnel people not to the top, but to the bottom, while funneling their wealth to the top. The middle class doesn't want to see that they are just one mistake away from poverty. Well, exactly, Meat Bomb. But that's the reality. The reality is that all of us who aren't in the incredibly privileged, ultra-wealthy category are just one misstep, one bad day away from becoming economically destitute. And none of us really want to acknowledge that. We all want to keep moving forward with this idea that we're fine, we're fundamentally okay. But the healthcare system in the United States is something that is going to sink us all eventually. We all eventually go to the hospital, guys. And I don't know about you, but I'd rather live in a country where if I go to the hospital, and even if it's a really bad day, I don't have my entire life destroyed. Death and flatulence. Let's see. Asset limits trap beneficiaries in poverty and have cascading effects on the economic and social well-being of all people with disabilities. As another recession looms, it is critical that Congress act quickly to implement long overdue structural changes to public assistance programs. Let's see. Some of these are allowing steady savings by eliminating tests, Asset Act, which would eliminate the asset limits for SNAP, TNAF, and the Low-Income Housing Energy Assistance Program. And it would raise asset limits associated with SSI from $2,000 for individuals and $3,000 for couples to $10,000 and $20,000 respectively, which would eliminate the marriage penalty, which would be a very good move. A very, very good move. Even though keeping these asset limits in place is, I think, misguided at best. Come live in Scandinavia? I would definitely consider living in Scandinavia. Either Scandinavia or New Zealand. Those are like my top two if I had to move to another country. Dandara Lemau Thank you for the follow. So, there are a lot of options being bandied around for asset limits. Here's a study from the asset limit from the Urban Institute from 2005 about asset limits preventing the accumulation of wealth. Which, no shit, of course they prohibit the accumulation of wealth. But additionally, when we're talking about people with disabilities, I found this interesting study from the National Library of Medicine, which is essentially comparing loneliness, social support, and social isolation and well-being among working-age adults, both with and without disability. And the general findings of this study are, unsurprisingly, here we go. Where did it go? Where? Wait. Oh, here we go. People with disability were significantly more likely than their non-disabled peers to report loneliness, low social support, and social isolation, and to report exposure to low social connectedness on more than one indicator. Effect sizes were significantly greater for loneliness than low perceived social support, which were in turn significantly greater than for social isolation. Adjusting risk estimates to take account of between-group differences in living circumstances significantly reduced effect sizes for all three indicators of low social connectedness. The prevalence of loneliness was highest among adults with disability who were younger, economically inactive, living in rented or other accommodation, living alone, and had low levels of access to environmental assets. The relative disadvantage in loneliness experienced by adults with disability was particularly pronounced for adults living as a couple in other housing arrangements, with low to medium levels of access to environmental assets and higher rates of neighborhood deprivation. All of this led to lower personal well-being in all analyses. It's basically the systems that we have in place right now isolate and make people with disabilities lonelier, and loneliness is associated with horrible health outcomes. And because we do not have good systems of support, aka a universal healthcare coverage of some kind, the effects on the disabled community are hugely disproportional. So all of these kind of come together in very different and unique ways. Because, for example, a lot of the disabled community doesn't have access to very much money, very many assets. They are then isolated from the rest of society, and that isolation in turn increases loneliness, and that loneliness in turn puts them more at risk for various health issues, both mental and physical. In fact, let's take a look here. While I was doing some digging on this topic, I came across this from the National Disability Council. This is from, I believe, 2009. So it's not being able to drive affects your ability to meet people. Who would have thought? So here, we have a list of recommendations from the National Council on Disability, my bad. And basically, I find this last one extremely illuminating here. I'll read it in full here. The U.S. Surgeon General should lead an effort with other federal agencies concerned with healthcare quality for people with disabilities, including the Department of Health and Human Services, Office of Disability, the Centers for Medicare and Medicaid Services, CMS, the National Institute on Disability and Rehabilitation Research, the Agency for Healthcare Research and Quality, the Access Board, and the Administration for Children and Families in a joint project that will establish principles of universal design for healthcare facilities and programs. Goals and objectives should be established and key stakeholder actions identified. Drawing on the well-established principles of the universal design for the built environment, this collaboration should bring together the federal agency experts, disability and health policy researchers, leading disability and health practitioners, e.g. physicians who specialize in caring for women with disabilities, people who are deaf or hard of hearing, and people with intellectual and developmental disabilities, as well as vision rehabilitation experts, and people with disabilities to participate in the process. The Surgeon General should publish a report of findings that builds on previous publications, such as Call to Action to Improve the Health and Wellness of Persons with Disabilities, Closing the Gap, a National Blueprint to Improve upon the Health of Persons with Mental Retardation. Oof, that hasn't aged well. And report on the Surgeon General's Conference on Health Disparities and Mental Retardation. So, buried in all of that, basically this recommendation from 2009 was essentially, hey, we need a joint project by all of these federal agencies to come together to figure out some kind of universal program that we could use for people with disabilities. Now, I don't know about all of you, but I think there's a pretty good universal program floating around out there that would help people with disabilities quite a bit when it comes to healthcare costs. It's this thing that we've been talking about called Medicare4All. We don't have to look that far for it. It would actually greatly improve the quality of life that people with disabilities experience. And if we can tailor that along with eliminating the asset limitations, or at the very least going with the current recommendation of $10,000 and $20,000, that would hugely benefit people with disabilities across the entire country. Let's stop means testing disability. Let's give people who suffer from disabilities or have disabilities the healthcare they need to properly deal with these. And let's stop punishing people just because they happen to be poor and in desperate situations. We can do all of these things through Medicare4All. We can do that. It's possible. That plan is there. It's there, and we can improve so many people's lives with it. So isolated people are more lonely, and people not getting proper medical help need better help. Great studies. I could have told them that, and they'd only have to pay me $1 million way cheaper. I know, it's wild. A lot of these studies are basic common sense, right? But it's good to have the studies behind the basic common sense too, because there are a lot of people who argue from a place of common sense, that you should means test programs, that you should apply these arbitrary limitations, because on a gut level, they feel like it makes sense. We have the benefit of being able to argue from gut feelings on these issues, and also backing it up with the research. Exactly, Mossy Stone. It'd be cheaper to not do means testing. I'm lonely as fuck. Most of my social interactions come from being here. Well, we're happy to have you here, Talon. We have one more. Okay. Oh, excuse me. So this comes from Bridge, Michigan, which is a nonprofit news source. Basically, this is a story of kind of the constant battle in the United States over healthcare and what should be done about it, right? This is from July. This is on a state level. And essentially, this is something that is at the heart of the constant battle about what should be done related to healthcare. So I'll begin reading. Whatever their politics, whatever their role, parent or provider, lobbyist or lawmaker, on this they agree. Michigan's complex mental health system needs fixing fast. But two legislative proposals meant to transform the system are facing pushback from families and mental health advocates. It's upside down, said Fred Cummins, unfortunate name, 79, whose late daughter Paige, a talented pianist, solid student, and hard worker as a teen, spent more than 30 years with schizophrenia, fighting voices and seeing messages in places like the designs of tile floors. He and other critics say they are once again fighting efforts that would ultimately privatize at least parts of the state's $3.6 billion mental health care system. Kay Flogan! Hello! Sorry. Thank you so much for the raid. Raiders, let me give you the spiel because we are currently doing an organizing event for Medicare4All. Thank you so much for being here. We are in the middle of pushing for people to join. Take a look in chat. M4A. Yep. Exclamation point M4A. Please click on the link in that to join the Medicare4All Discord if you are interested in all at organizing on local and national levels to make sure that we get Medicare4All and that we get any and all tangible steps towards a Medicare4All system. That is what we are trying to do, and I really do appreciate the raid. Welcome, everybody. Thank you so much for the follows. A non-available username, Recursive Rose, Curly Fries 1017, and Main Captain. Thank you all for the follows. I really, really do appreciate it. So please do hit the follow button because I always appreciate the follows. Raiders, click the little picture of my face below stream so that I get credit for your eyeballs. But most importantly, click that Medicare4All link, get involved in the Discord, and help us push for Medicare4All across the United States. It is really, really easy to join. It's a really great way of being able to join a larger movement that will get you involved in Medicare4All and can be mobilized for future fights. So please, please, please click that link. That's the entire point we're doing this stream. And we are also doing informative content. We're going to be here all night talking about Medicare4All and the issues affecting people across the country. Currently, we are talking about how these systems affect people with disabilities of all kinds, how our current healthcare system in the United States is broken and punishes people with disabilities. And I would love it if you stick around and join in this. And also, if you would be at all interested in going on social media and sharing a link to this stream, I would very much appreciate it, especially as I hope this will further the fight for Medicare4All in the United States. So, I appreciate all of you being here, and yeah. Thank you so much for the raid, K-Flow. I support the K-Hive, okay? On top of that, we will be doing call-ins in about 30 minutes. So if you want to join our private Discord, please do. And you can join the waiting room, and you will be pulled in as I see fit. To share stories about your experiences in the healthcare in the United States. So yeah, thank you so much for being here. I really do appreciate it. Hopefully you didn't all leave during my spiel. All right. So, essentially, to get back on track with what I've been talking about, one of the constant fights when it comes to especially disability healthcare is that there is a huge healthcare industry around disability, around caring for people with both mental and physical disabilities. And that industry is rife with people trying to make a big profit. And so when people see that there are issues in the healthcare industry around people with disabilities, a lot of people see dollar signs in their eyes. A lot of those people want to make a profit at the expense of people with disabilities. And this is something that's happening in Michigan right now. So, let's see. Here we go. Here we go. The plans, one from Senate Majority Leader Mike Shirkey, a Republican from Clark Lake, and the other from State Representative Mary Whiteford, a Republican from Casco Township, would essentially eliminate a layer of bureaucracy that now includes up to 10 managed prepaid inpatient health plans, or PIHPs, across the state that contract with the local community mental health agencies to provide services. Yeah, exactly. Phoenix Marine. We were just talking about the means testing that goes into people with disabilities, and how they deny the majority of claims, and how by denying these claims they're putting people with disabilities in really difficult positions where they can't get care for their disability, and they also can't get money, and it's just a no-win situation. Are you winning Medicare for All, Jack? I really hope so. I hope you all stick around, talk about this, and join, again, the Medicare for All Discord. Yeah, you don't look disabled, exactly. Marge Mitchell, a longtime advocate for disability rights and executive director for Michigan Universal Healthcare Access Network, a statewide network promoting healthcare for all, said if the Shirkey or Whiteford plant proposals were to go into effect, it would result in a lack of accountability that she called just appalling. Let's see. Mitchell and Cummins, as well as the parents and advocates that gathered with them last week in Oakland County, say they oppose both proposals as written. The plan from Shirkey, which had previously pushed for shifting the system's managed care to private health insurers as the so-called Section 298 effort, would essentially eliminate PIHPs and shift part of the state's responsibility to commercial health insurances so they can manage and contract for services, essentially privatizing the health insurance of people with disabilities. In shorthand, Shirkey's plan has been described as the plan that would privatize Michigan's mental health system. Shirkey and fellow Republican Dr. John Bizon of Battle Creek formally introduced the two-bill package to the legislature on Thursday. Shirkey told lawmakers that the plan begins a long process to replace an outdated model with one that will ensure that those who are among our most vulnerable population continue to get the services they need for a profit. Though the bills lack bipartisan introduction, Shirkey said he sought input from almost every known interest group related to this industry. Yo, you sought input from every known interest group related to the industry. That's just politician speak for saying that you talked with a lot of lobbyists. Good lord. Imagine being that brazen about it, too. Oh, no. Phoenix Marine, what he means is he talked to people who had money to give him for privatizing the health insurance industry in Michigan. A second proposal introduced by registered nurse and state representative Mary Whiteford and co-sponsored by Republican and Democrat colleagues would also eliminate the network of 10 PIHPs. The proposal would replace the network with a single public or nonprofit administrative services organization, or ASO, defined as a contract third-party organization with special expertise in behavioral health systems management. While both proposals essentially eliminate PIHPs as a way to streamline one layer of bureaucracy, Whiteford and Shirkey's plan relies more on shifting that layer of managed care to private insurers, while her plan is more of a free fee-for-service model, allowing clients to choose the care they want and whatever they want, with the state more directly picking up the cost. All of these sound terrible. Let's see. Michigan has long suffered from a shortage of psychiatrists and other mental health professionals, making access to care more difficult. But COVID this past year pushed the system to a breaking point as it isolated residents and sent anxiety and danger and anger rippling through communities. Perhaps the most stunning has been the pandemic's toll on children. Michigan's 334 child psychiatric beds have often been filled with suicidal and other youth in crisis. And as Bridge, Michigan recently reported, children and teens in crisis routinely had to wait days or even weeks for specialized care, overwhelming hospital emergency rooms and sending families reeling with little help. Um, yeah. Again, one way we could alleviate that is, by having Medicare for all. Let's just have Medicare for all, and also build the facilities we need without the profit model, without the profit motive, because the profit motive is why you don't have enough beds for children, right? Like the profit model, like it's not profitable to have mental health beds for children because there aren't as many of them, generally. like goodness. Also, Wayward Historian, thank you for gifting K. Flogan a sub. And Main Captain, I don't know if I said thank you for the follow, but I appreciate it. Let's see. Those mental health agencies would be directly overseen by Michigan Department of Health and Human Services, suggested Bob McReevy, longtime advocate whose son had mental illness and now lives in a group home. Basically, people who are pushing for actual reform are saying it should be decided on local levels by local communities to make local decisions. And here's a quote from Bob McReevy. "You put the department back where it belongs. You hand the accountability back to the state." He and others also say a lack of adequate funding for mental health is the biggest impediment to quality care rather than bureaucracy. "We spend so much time talking about structure, but we're not talking about the fundamental problem, and that's about access," said Nick Kiamitoro, a member of the Macomb County Community Health Board, Mental Health Board. He's a former prosecutor, state representative, and union leader who was among those who met in the AMI of Oakland County offices last week. The lack of funding leads the argument back to one of accountability. So again, one of the best ways to fund these programs would be through a Medicare for All system that would then allow the government to come in and fund more facilities, even if they're not profitable. That would be the best way to increase funding, through a universal system that can come in and run at a loss, because the government doesn't have to make money. Because that's kind of the difference between government and a private corporation. And a lot of times it's the family unit themselves are contributing to the children's mental health issues. True. The pandemic has forced children to live in abusive homes with nowhere to escape. Also true. The public system's motivation is because there's no profit to be taken. Any money we save goes back into services, so the motivation is to serve people, said Robert Sheehan, executive director of the Lansing-based Community Mental Health Association of Michigan, who helped fight earlier efforts to privatize the system's managed care component. Insurance companies' motivation, of course, is by law they have to increase their value for their shareholders, for their owners. So their motivation is to spend the least amount possible on care that allows them to walk away with a larger dollar amount, which is absolutely true. That's absolutely correct. Hello, Entrama. Phoenix Marine 2021, thank you so much for hitting that follow button. When we're talking about these issues, right, when we're talking about the loneliness people with disabilities experience, when we're talking about the costs of means testing, when we're talking about the quality of life for people with disabilities, all of these questions come back around to healthcare. We cannot be truly free. We cannot truly pursue happiness. We cannot truly exert our abilities on the world unless we have the confidence that we are going to be okay if something, bad happens. If we happen to get hit by a piece of falling space debris, for example, or get struck by lightning through no fault of our own. Acts of God happen all the time to punish and hurt people. So, let's make sure that people are covered. There's no excuse for us to be living in a world where, someone can't afford a wheelchair. There's no excuse for us to be living in a world where someone can't afford, a dialysis machine or to get dialysis in the first place. God sounds like a bully. Well, he kind of is when it comes to healthcare. There aren't excuses. It is cheaper for us to have Medicare4All. It is cheaper for us to insure every single person in the United States, especially those with disabilities. It is cheaper for us to do these things and cut out the middleman who exists to take a profit and who spends money lobbying the government so that they can make more of a profit, that spends money on advertising so they can make more of a profit, and then all of those profits get sucked up into 100 individuals to take home as yearly bonuses. I had an accident this past Tuesday. I had to go to the emergency room, and I'm dreading the medical bills that will start pouring in. 3 of my teeth are splinted together. These dental bills are going to pile up also. Oh, Phoenix Marine, I'm really sorry to hear about your accident. I'm glad you're doing okay now. But yeah, the bills are scary. We have some time before the open call-in section. So I'll just add, if any of you want to come in and share your stories of the American healthcare system, of survival and perseverance in the face of unnecessary bureaucracy, please join our Discord and join the waiting room underneath the streaming tab. And I'll be able to pull you in and you can share your story. Our next hour is dedicated to talking about the stories of people in our community, and I would very much love to hear from you. I had to pay a copay every doctor I saw this week, and I've missed 1 week of work. Jeez Louise, I'm so sorry to hear that. So one of my big stories, one of my first encounters with the healthcare system of the United States of America, right? It was just a normal day. Nothing big was happening. I think it was a Sunday. I remember because I was worried that the doctor's office wouldn't be open and I'd have to go to the emergency room. So I woke up at 2:00 in the morning to go to the bathroom, right? And in the dark of the night, I suddenly felt just a shooting pain in my abdomen, and I didn't really know what it was. And I was just well, maybe it'll go away. And I kept waiting, and over time, as the minutes ticked by and turned into hours, the pain just kept getting worse and getting worse and getting worse. And I wound up rolling on the ground in my kitchen in agony, just convulsing in agony. And I didn't know what to do, but I knew I didn't want to call 911 because if I called 911, I would get a huge medical bill for the ambulance, right? And I knew I didn't want to drive myself to the ER because if you go to the ER, that's a huge medical bill too. And so I decided I would just wait until the clinic opened at 7:00 in the morning, right? And so I waited until 7:00 in the morning, rolling around on the floor of my house in agony in the kitchen. And I was able to get over to the clinic when it opened, and I got in to see the doctor, and essentially the doctor was like, well, you're gonna have to go to the emergency room. I was like, wait, what? I was trying to avoid that. He was like, yep, sorry. I was like, okay. So I went to the emergency room. Anyway, despite my best efforts not to, I ended up going to the emergency room, still in massive amounts of pain, by the way. And while there, I got a bunch of blood tests going, still in massive pain. Very nervous that as a trans person, I was going to be discriminated against at the hospital. Very nervous about all this stuff. and I was getting my blood drawn, and I hadn't eaten in like 16 hours at that point. And then eventually they were like, hey, you actually have like an infected gallbladder, and you have massive gallstones that are blocking up your bile ducts. Essentially, when you have an infected gallbladder, it produces gallstones, and if they get caught inside your body, they cause a massive amount of pain. They're like kidney stones, but they come from a different place. And I asked the doctor, well, why do I have an infected gallbladder? Like, what happened? Could I have avoided this? And the doctor was just like, no, just bad things happen sometimes. Bad luck, I guess. And walked away. And I'm just like sitting there, laying there going like, so I just woke up one day and had bad luck. I woke up one day, had bad luck. There is nothing I could have done to prevent myself from getting gallstones. And yeah, you can't pass gallstones. Yeah, that is one of the other things. I was lucky that they had an opening in surgery because they had to surgically remove my gallbladder immediately. And so I got the apparently no one knows how gallstones are formed. Yeah, exactly. Like, it just happens. And so I had my gallbladder removed, and the like I had to stay in the hospital, I think 2 nights or maybe 1 night. I my memory gets fuzzy because they had to put me under. And I eventually I got home, and after a brief recovery period, I was fine, which is great. But then I got a hospital bill, and that hospital bill was, if I had had no insurance, and I was lucky that I had insurance at the time, would have cost me $15,000. It would have cost me $15,000 for something I had no control over, never could have seen coming, and just happened to me randomly at 2 o'clock in the morning one day, out of the blue, right? All of a sudden, $15,000 medical bill. Now, luckily, I did have insurance, but even with insurance covering the entire thing, because of the way my insurance is set up, I still had to pay a portion of that. So I wound up paying $5,000 for that procedure with insurance coverage. So with insurance coverage, I wound up paying $5,000, and I was lucky enough to be in a economic position at the time where I could afford an unexpected $5,000 charge. But the truth is, most people in the United States aren't lucky enough to be in a financial position to just be able to shell out an unexpected $5,000. I was lucky that I had just a small amount of money saved up from my freelance work. Like, I'd just gotten paid for a bunch of contracts. Most people in the United States pre-pandemic didn't have $400 in their bank account to spend on unexpected expenses. Most people don't have $400. And that was pre-pandemic. Now it's probably around, like, I don't know, $200? Probably got cut in half.